This is David Viniker, consultant obstetrician and gynaecologist in London. Welcome to my first video on developments in obstetrics and gynaecology, and this one is on women's health and the internet. During my first trainee post in obstetrics and gynaecology back in 1972, we looked after a lady who had abdominal pain, and it proved to be an ectopic pregnancy. This was her second ectopic pregnancy, and at that time the treatment was surgery and the removal of the fallopian tube with the ectopic pregnancy. From our point of view, our operation had saved her life, but understandably she and her husband were very distressed as they had no children, and by the removal of her second fallopian tube she had become sterile. The couple wondered if there was some plastic tube that we could introduce that would allow her to conceive, but no such option was available, and sadly we had to explain that her chance of pregnancy had disappeared and that their only chance of parenthood would be to adopt a child. Little did we know that within just a few short years in vitro fertilization would be developed just for this situation, for a woman who had fallopian tube infertility. It's over 30 years since Louise Brown, the first successful outcome with IVF, was achieved. Hopefully our lady from 1972 would have learnt about this, and I hope that she had a child. I really do not know. This case demonstrates the incredible developments that I have been privileged to see during my career. In this series, I propose to look at some of the developments that have occurred in obstetrics and gynaecology during my career. I think over the last few years, perhaps the most important development from a patient point of view is the amount of information that is available. 40 or 50 years ago, patients just accepted what doctors would tell them. But as medicine has developed, there have been more and more options from an investigation point of view and also from the point of view of the treatments that are available. Over the last 15 to 20 years, the internet has become a major focus of our attention, and it provides us with an amazing source of information. For those of you who are familiar with my website, twowomenshealth.com, there is a navigation menu, and in this series I plan to start at the top and gradually work my way through the various topics and take a look at information that is available for patients on the internet. I'm pleased to be able to let you know that there are more than 50 million websites on women's health, and certainly within the UK, my website is right at the top. This web article demonstrates how frequently women resort to the internet. It says that, in fact, 69.4% of women cite the internet as the primary source for their information, to keep their household running with information on family activities, recipes, and health news. Although women in their 20s and 30s and 40s use it more frequently than older ladies, the ladies beyond the age of 65 are still using it for 62.5% of their information requirements. Research by Susanna Fox is interesting in that it shows some of the changes that are taking place in terms of internet information, but also how easy it is for information to be incorrectly quoted. Here we are told that she tells us, when we did our first health study in the year 2000, the American Medical Association sent out a press release asking patients to make a New Year's resolution not to go online. When we look at the original press release in 2001, it would suggest that the American Medical Association weren't being correctly quoted. This is what they actually said. Millions of Americans go to the internet for health-related information, but people who use it to self-diagnose and self-medicate may be putting their lives at risk. Only your physician has the necessary experience and medical training to diagnose and treat medical conditions. If you have questions, trust your physician, not a chat room. I am sure that you will appreciate that there is a big difference between a chat room and information provided by a professional health person. More recently, Fox has told us that things have really changed in the last 7 years. A 2005 study by the National Cancer Institute found that most doctors want to hear from patients about the research that they are doing online. When we go online to seek information, we must find a way of evaluating the quality of the website that we are looking at. There are many sites that are useful, but others may present information that is inaccurate or misleading. You can tell a great deal about the quality of the information provided by taking a look at the About Us page. There is usually a link at the top of the majority of web pages. From a health point of view, a website with information provided by the government, a bona fide university, a health organisation, a hospital, or a qualified doctor or other health professional is likely to be valid. This is David Viniker, consultant obstetrician and gynaecologist in London and author of my website twowomenshealth.com. Thank you for watching this video.